Hi guys, how are you doing today? By the way, my name is Rhea May Herian, a third year student of NURSO BSc, taking up Bachelor in Agricultural Technology, major in Animal Husbandry. So today, I'm going to tackle about the diseases of horses that causes their nervous system. First, we have the APM. APM for short is a disease that affects a horse's nervous system, commonly displayed as incoordination of the limbs, muscle atrophy, or lameness. Muscle atrophy, it is the loss of skeletal muscle mass that can be caused by immobility, aging, and malnutrition, while the lameness is an abnormal gait or the stance of animal that is a result of dysfunction of the locomotor system. EPM appears to be a condition strictly located in the Western Hemisphere. EPM is a serious disease, but signs can sometimes develop slowly and be very difficult to recognize. However, once diagnosed, this disease should be treated as soon as possible to prevent further neurological damage. So now we have the symptoms. Since EPM is a neurologic disease, affected horses will display a variety of neurological symptoms can be disturbing to horse owner. First of them is the lameness, loss of muscle movement, coordination or ataxia, paralysis of the lips and the ears, droppiness in the eyelids, difficulty of eating, example, inability to chew or to swallow their foods, muscle atrophy, weakness, seizure that is so very rare. Now we have the causes. EPM is an infection due to the single-celled protozoal organism Sarcoidosis neurona. This organism survives in the environment through its natural host, the opossum. In the body of the opossum, this protozoa undergoes several complex stages of reproduction. Its eggs, called sprococytes, are released into the environment through the feces of the opossum and digested by other animals such as raccoons, armadillos, and even cats. Each of these animals are called intermediate hosts, since they are necessary for the further development of the protozoa. Sarcoidosis neurona does not cause harm to either the opossum or these other intermediate hosts. However, if a horse consumes infected fecal material from an opossum, the horse becomes an aberrant host, meaning it is not the correct host for this protozoa. As such, the protozoa causes problems in the equine species. Horses are not able to pass the infection along the other horse because the protozoa is unable to continue its development in the body of the horse. Once in the horse, this protozoa migrates to the nervous tissue in the spinal cord and occasionally the brainstem, where it is caused severe inflammation and damage. We have now the diagnosis. Diagnosis of this disease can be changing. Serum sample taken from your horse can detect the presence of antibodies against these organisms. Yet, if present, these antibodies only indicate exposure and not necessarily active infection, as CSF or cerebral spinal fluid. It may also help indicate this infection. A few other laboratory tests are available and each comes with its own set, or false positive and false negative. Your veterinarian will typically rule out the numerous other neurological conditions before conducting tests to diagnose EPM in the animal. Now we have the second disease. It's called CSM, or cervical stenotic myelopathy. This is one of the most common causes of spinal ataxia in young horses. The layman's term for CSM is a Wobbler syndrome. Alternative scientific terms to describe the condition include cervical vertebral malformation, instability, and cervical compressed myelopathy. In this condition, neurologic gait deficits result from compression of spinal cord by the malformed cervical vertebrae. Develop orthopedic disease of the appendicular skeleton such as cystitis, joint infusion, osteochondrosis, and flexural limb deformities occur from frequently in horses with CSM. A direct cause and effect relationship between osteochondrosis and CSM has not been identified. However, the associative relationship indicates the pathopsychology of these two conditions is similar. The cause of CSM is likely multifactorial, consisting of genetic and environmental influences. It is unlikely that CSM is heritable by simple Mendelian dominant recessive patterns. The mode of inheritance more likely involves multi-alleles and variable penetrance, which determine genetic predisposition to a CSM. A high plane of nutrition, micronutrient imbalance, rapid growth, trauma, and abnormal biomechanical forces likely contribute to develop of CSM is genetically predisposed individuals. These are the this is the example of the CSM that causes their muscle. The third one is cervical spondylomyelopathy. It is also called cervical vertebral malformation. Malarticulation and Wobbler syndrome is a compression of the spinal cord caused by abnormal development of the cervical vertebrae. Genetic factors and possibly nutrition be involved. In horses, cervical spondylomyopathy is the most common non-infectious disease of the spinal cord and occurs in many breeds. Most horses present at 3 years of age, although they can be affected at any age. The mid-cervical region is most commonly affected, and there is spinal ataxia and tetraparesis. Diagnosis is based on imaging and excluding other causes. Plain radiograph may show abnormal articular facets and stenosis of the vertebral canal. Myelography is necessary for definitive diagnosis and surgical planning. Non-surgical treatment involves NSAIDs and intermittently sulfoxide to reduce inflammation. In yearlings, diet modification can help. Surgery most commonly involves ventral fusion on the affected vertebrae. Approximately 80% of affected horses improve with surgery. Owner-rider safety is a major concern in horses with ataxia. Once clinical signs of ataxia are apparent, a tocopherol supplementation will not improve the neurologic deficits. Progression of the disease can be halted through supplementation, but the general proprioceptive ataxia will remain. Clinically, signs of the disease typically progress at varying rates until the horse reaches 2 years of age, at which time signs stabilize. Currently, the best management practice for prevention of NAD/EDM is to maintain pregnant mares, foals, weanlings, yearlings, and 2-year-old horses or lush green pastures. They ensure adequate consumption of vitamin E to protect against neurodegeneration in the following central nervous system. If adequate pasture is not available, the best practices outlined should be followed. There's some note. The critical window indicates this window, which is a serum of tocopherol levels will significantly lower the NAD and EDM susceptible fowls. To determine the fowls, in need of supplementation, serum concentration of tocopherol should be evaluated in this frame. The purple square, this one, along the timeline indicate the frame with the neurological exam should be completed and with the first month of life and every 6 months thereafter. The fourth one, we have the equine herpes virus or EHV. Equine herpes viruses are viruses that are found in the most horses all over the world. Almost all horses have been infected with the virus and have no serious side effects. It is currently unknown what causes some infected horses to develop the serious neurological forms that may be fatal. EHV is a common DNA virus that occurs in horses population worldwide. The two most common species are EHV1, which causes abortion, respiratory disease, and neurologic disease, and EHV4, which is usually respiratory disease only, but can occasionally cause abortion and rarely neurological disease. Respiratory disease caused by EHV. EHV is most common in windfalls and yearlings, often in autumn and winter. Adult horses are more likely than younger ones to transmit the virus without showing signs of infection. EHV1 results from widespread vascular or blood vessel injury after damage to the lining of the blood vessels of the blood-brain barrier. Neurologic signs result from inflammation of the blood vessels, blood clots, and death of neurologic tissues. Causes of EHM occur silently or can affect multiple exposed horses. They may or may not be associated with the previous or ongoing EHV1 respiratory or abortion disease outbreak. EHM diagnosis, like this picture, this is caused by the EHM. Diagnosis of EHM is based on clinical signs and isolation of the virus. Diagnostics performed by your veterinarian may include the nasal swab collection for laboratory examination and detection of the virus, quantitative polymerase chain reaction or qPCR assay, and or by virus isolation. Second one is the blood collection to detect virus by qPCR assay or by virus isolation. The third one is the blood sample should be collected 2 to 3 weeks apart for levels and antibodies specific to EHV1. So now you may go to the muscle disorders in horses. First, we have the myopathies. Myopathies are diseases that primarily cause damage to muscle. They may be present at birth, congenital, or occur due to nutritional imbalances, injury, or indigestion of a poisonous substance. Myositis is an inflammatory reaction in the muscle. Common causes includes infection, parasitic disease, and immune-mediated conditions. Muscle disorders can appear with a variety of signs ranging from muscle stiffness and pain to the muscle atrophy, weakness, exercise intolerance, and muscle fasciculations or twitching. The most common signs are muscle pain, stiffness, and reluctance to move due to rhabdomyolysis, which may or may not be related to exercise. Muscle weakness or damage can also occur as a sign of many different disorders such as nerve trauma and influenza. Only condition in myopathy or myositis are primarily involved are discussed in this section. Exertional myopathies in horses involve are discussed in this section. The diagnosis for the myopathies. Differential diagnosis for reluctance to move, acute recumbency, and discolored urine include lameness, colic, laminitis, fracture, pleuromania, tetanus, and arto-iliac thrombosis. Neurologic disease resulting in recumbency or reluctance to the move, intravascular hemolysis, and bilirubinuria. Cause of non-exercise associated rhabdomyolysis includes infections. You can see the diagnosis of the equine myopathies in the internet if you want to have some elaboration for this content. Now we may go to the diseases of the horses that affect their skeletal system. Bone fragility syndrome. The BFS, also known as bone fragility disorder, is a debilitating bone disease that causes horses to develop lameness, outward bowing of the shoulder blades, sway back not associated with the advanced age, and the neck stiffness. Severe bone loss or osteoporosis cause this sign along with the weakening and ultimately spontaneous breaking of the bones. The bones usually impacted include to the scapulae, ribs, pelvis, and vertebrae. Affected horses progressively worsen until they die from catastrophic bone fracture are humanely euthanized. The condition can affect horses of all ages, breeds, and genders. Causes of the BFS remains unknown. However, many horses also have chronic lung disease called pulmonary silicosis that results from inhaling toxic silica crystal from the soil. Once inhaled, this crystal move into the lungs, tissues, and surrounding lymph nodes and incite chronic inflammation. Horses with pulmonary silicosis often exhibit exercise intolerance and with advanced disease develop breathing difficulty while at rest. This condition has no cure. Sad, but it has no cure. Researchers do not yet understand the connection between BFS and pulmonary silicosis. Not all BFS horses have evidence of pulmonary silicosis, and not all horses with pulmonary silicosis have developed BFS. However, all horses with BFS have lived in the certain geographic regions where soils containing these toxic silica crystals, example, chrysomite and tridymite, are found. All horses with BFS lived in California at the time of diagnosis, have history of living in that state. Within California, affected horses have been diagnosed in many countries along coastal mountains range and Sierra Mountains. The diagnosis for this one is the diagnosis of BFS is particularly in the early stages of disease. It can be difficult as the presenting complaints that usually interminate lameness and body stiffness. The most definite test of all stages of BFS is a nuclear scintigraphy or bone scan. Areas of high bone activity associated with bone loss can be seen as bright spots as on the bone scan images. In horses, moderate to severe disease, veterinarians can make a diagnosis based on the scapular spine widened appearance on ultrasound. And in severe disease, bowing of the scapula is evident upon physical examination. Since the bony changes associated with the BFS could occur with any diseases that causes systemic bone loss, such as calcium, phosphorus imbalance leading to hyperthyroidism, veterinarians must consider diagnostic tests and examination findings in combination with a complete history of physical complaint as well as history of where the horses has lived. So, it is the end of my presentation. So, I hope it can help you not it can help you that good. Thank you.